When was the last time you actually took care of your penis? Not just cleaning it, but really caring for it like your heart, your teeth, or your joints. Most men ignore this part of their health until it's too late. But here's the truth. The men who give it daily care stay strong, confident, and connected well into their 70s and 80s. Today, I'll show you a simple science-backed routine that protects your circulation, nerves, and hormones, because caring for your penis isn't vanity, it's self-respect. Understanding what changes after 50. After 50, your body quietly shifts. Testosterone dips, blood flow slows, and nerve sensitivity fades. That doesn't mean you're broken. It means your systems need more care. The penis is often the first to notice circulation issues long before your heart does. Declining firmness or sensation isn't failure. It's feedback. A signal that says, I need support. When you listen and act early, you're not just helping your performance. You're protecting your long-term health. Circulation. The foundation of penis health. Blood flow is everything. Without oxygen-rich circulation, nothing else works. The penis often shows early warning signs of poor cardiovascular health, weak firmness, fewer morning erections, or less sensitivity. The fix isn't magic. It's movement. Gentle walking, stretching, or pelvic exercises keep those blood vessels open and flexible. Even 5 minutes of light movement helps flush out waste and keeps your tissues responsive. Remember, movement isn't a chore. It's how you keep your body and your manhood alive. Reawakening nerve sensitivity. As nerves age, signals slow. That spark between your mind and your body doesn't disappear. It just needs more care. You can reawaken sensitivity through relaxation and gentle touch. Try warm baths, light massage over your abdomen and thighs, or applying natural oils for circulation. Not arousal, but awareness. Hydration and B vitamins, especially B12, also help nerve health. This isn't about performance, it's about presence. Reconnecting with your body helps restore feeling, confidence, and calm. Skin and hygiene, the overlooked essentials. The skin down there is delicate, thin, and sensitive, especially as you age. Clean gently with warm water, never harsh soaps or alcohol-based products. Moisturize once or twice a week with a fragrance-free lotion to prevent dryness or cracking. For men who sweat or wear tight clothing, a natural talc-free powder helps reduce irritation. This isn't cosmetic, it's comfort and protection. When your skin feels calm and cared for, your entire nervous system relaxes. That's real confidence. Mindset. Shifting from pressure to presence. After 50, many men carry quiet anxiety about performance or desire. That tension shows up physically, tightening muscles and blocking arousal. But what if you stopped fighting your body and started supporting it? See your penis not as a source of pressure, but as a partner. Approach it with curiosity, not frustration. When you relax, your nervous system opens up. Blood flow improves. Function follows. This is not about perfection. It's about connection. Your simple daily routine. So here's your 5-minute care plan. Move daily, walk or stretch. Hydrate and eat for circulation. Take a warm bath a few times a week. Massage gently for nerve awareness. Moisturize for comfort. Breathe deeply to reduce stress. These simple acts train your body to stay responsive and alive. Penis care isn't about vanity. It's a quiet act of self-respect. Proof that you still care about your strength, comfort, and dignity. Small daily habits become lasting vitality. Gentlemen, your penis isn't separate from your health. It's a reflection of it. Care for it like you care for your heart or your teeth. Movement, touch, skincare, mindset. These are small daily gifts to your future self. If this message helped you, hit like, subscribe, and share it with a brother or friend who needs to hear it. I'm Dr. Zoe Hartley reminding you, your best years are not behind you. They're waiting for you, one small act of self-respect at a time.